Well, I think as workforce issues become more and more important, nurses may become fewer and fewer, then safety really is a topical issue that we need to think about in order to make sure we present the best care we can for patients with limited sometimes resources, and we do it in the best way that we possibly can. So safety really is a priority issue for everyone today, including the multidisciplinary team. We're involved in a number of initiatives, including assessing what nurses feel are important issues in their workplace, such as cytotoxic safety, handling drugs safely, avoiding adverse events or accidents that patients may encounter when they're in a hospital. So we lobby, we advocate, and we're working at a European level to raise awareness of safety and the role that nurses play in promoting safety within the healthcare system. I think a very important issue recently is the demand for HPV vaccination. I think it's become one of the major decisions that governments have to make about protecting girls and boys against HPV infection. It's the leading cause of cervical cancer in women, and it's also implicated importantly in oropharyngeal cancers in men as well as other cancers, and it's an entirely preventable disease. So when you think about safety and preventing cancer and keeping the population safe, I think HPV vaccination really is an important issue that we need to address, not just in Europe but across all countries, including those in the developing world. Well, I'm a great believer in the fact that we can only work and argue if we have the evidence there. So research gives us the evidence on which to base our case. The HPV vaccine is a good example where the evidence is incontrovertible now. We can't argue against the efficacy. So we need similar evidence for nursing interventions and nursing outcomes. So I think research can only come and with those conclusions if we have resources and we have the ability to do research as part of our role.